how does the ACA work? Clients, or assisted by agents, shop for plans on healthcare.gov, EDE platforms like Health Sherpa, or state exchanges. Oh, excuse me. Sorry, everyone. Computer just restarted. They're based on income and household size. They may qualify for premium tax credits, which are known as subsidies, if you've heard that phrase. The plans, they're standardized into metal tiers. We have bronze, silver, gold, and platinum. Some households also qualify for what's called cost share reductions. They show up as a CSR, which lowers copays, deductibles, and other out-of-pocket costs, usually making silver plans a strong value option. So they go from the income to the subsidy to the plan selection. My goodness, I am so sorry, everyone. I was having some tech issues this morning, and now it's affecting the presentation. I do apologize. So what do ACA plans cover? All marketplace plans cover 10 essential health benefits. Remember that. These would be things like outpatient care, preventative care and wellness services, prescription drugs, hospitalization, maternity, newborn care, pediatric services, including child dental and vision, rehabilitative services, emergency services, lab services, and mental health substance use services. Up here, note, most health plans cover a set of preventative services like shots and screening tests at no cost to the client. So when you hear like, oh, I'm going into my wellness visit or I'm going into my annual checkup, that is always covered by a marketplace plan at no cost to the client. Now, who qualifies? Who is able to get a marketplace plan? Well, you must live in the United States, must be a U.S. citizen or a national, or be a lawfully present non-citizen in the United States, not be incarcerated. You need to be a tax filer to qualify for subsidies. You must not have coverage elsewhere. Employer, Medicaid, Medicare, etc. Those very rarely, that last one does have some contingencies rarely, but typically you cannot have coverage elsewhere. When I mentioned that you need to be a tax filer, if you are married, you have to file your taxes joint. You have to claim your income and your spouse's income on that same tax return. If you have kids, they need to be included. So tax filing to the correct tax status. Enrollment periods. The enrollment periods is open enrollment. That goes from November 1st to January 15th for plan year 2026. Next year, it'll actually be reduced for 2027. It'll be November 1st to December 15th. Now, there also are things called special enrollment periods. This is outside of the general open enrollment that is triggered by certain life events. This is just to name a few. There are multiple. Loss of qualified coverage. So if someone loses their job, they change places of employment who doesn't offer insurance. They just get married. That would mean their tax status would change. They just have a child, they're moving counties, etc. There are multiple of those. You can look on healthcare.gov at this special enrollments. Now, why we need great ACA agents, and this is where you come into play. Millions of people still do not understand how ACA works or what they qualify for. Knowledgeable, caring agents bridge the gap, guiding clients to affordable, life-changing coverage. Many people go without coverage simply because no one explained their options. This creates a meaningful career with long-term stability. Biggest thing on that third one, I talk to so many people who, whether they were enrolled in a plan or they haven't been yet, they are so confused. There's just so much information. To us as agents, it's pretty straightforward, makes sense. A lot of these people, guys, this is a foreign language to them. So the reason we need great agents It's just to help educate and, be there for these different individuals. Now, why is ACA a strong product? Why couldn't you just do a short-term medical or do a different off-marketplace plan? Well, it's affordable to millions due to those subsidies. They lower the cost. Comprehensive coverage, it includes preventative and major care, no exclusions for pre-existing conditions, and it caps out-of-pocket costs to protect from medical debt. ACA is a very strong product for multiple reasons, but these are some of the core reasons. There are some insurance plans, you guys, that if you get on that insurance plan and say you are already pregnant, for example, if you are pregnant within the first 12 months, it technically is considered pre-existing and you wouldn't be covered for it. Crazy, I know. ACA does not do those exclusions. The ACA has so many regulations that the insurance companies have to follow, that the medical facilities have to follow. So super important to know that this is a very strong product for your clients. In addition to that, what to do next? The ACA has made healthcare possible for millions who previously couldn't afford it. Now that you know the basics of what the ACA is, how it's a strong product, the rest is simply applying it in real world situations. Now is your time to get in front of people and to talk to them, help them. So, how do you do that? First, you got to be licensed. You passed your state exam, and you're officially licensed to sell health insurance. So, take your state test wherever you may reside.